Hi there, I'm Ayesha Hazarika. I'm a columnist for the Evening Standard, and welcome to the lockdown sessions. We're delighted this week to be joined by the Mayor of London, Sadiq Khan. Hello, Sadiq.
Good to see you again. How are you doing?
I'm good. Thanks so much for joining us. Now, it's been a bit of a grim week in terms of how the COVID story is unfolding. We hit this very tragic milestone of 100,000 deaths, and of course, large number of deaths in the capital. Your sort of reaction to that, first of all?
Well, it's heartbreaking. It's not just a number. In London, we've lost more than 13,000 Londoners. That means there are 13,000 families who are grieving, who are bereaved. I've lost a couple of friends. One aged only 53, no underlying health issues. He leaves behind 4 children. Another friend I lost is just north of 60. He's left behind a widow. And so I think there aren't many Londoners who haven't experienced either the virus themselves or know somebody who's lost their lives. And it's heartbreaking because the bad news is that over the course of the next few days and weeks, there'll be even more Londoners and people losing their lives. And my really big concern is, what makes me angry, is that many of these deaths were preventable. So I'm quite keen to make sure we learn in real time lessons so we can avoid further deaths over the coming days, weeks and months.
I mean, I think you're so right about how where we've got to in the story now, it is touching us all personally. In fact, I remember at the beginning of the pandemic, Joe Murphy, the Evening Standard's political editor, said to me, you know what, I think this is going to be really serious. And I think at the end, everybody will have known somebody who has lost somebody. And that is absolutely where we are now. Now, one of the stories we've been covering in the Evening Standard is looking at some of the disparities between different boroughs. Richer boroughs seem to be having a much lower death rate than more disadvantaged boroughs like Newham, Tower Hamlets, Barking and Dagenham. Why is that?
Well, I noticed back in April when I often write letters to bereaved families, I recognised a number of the names as being names that are clearly names of ethnic minority Londoners. And so I started asking questions and I wrote to the government. I asked the Equalities and Human Rights Commission to investigate whether there was disproportionality, and they've agreed to do so. And what's clear now and confirmed in relation to both the first wave and what we're seeing now is there are a disproportionate number of Black, Asian, minority ethnic people losing their lives, both catching the virus and suffering really adverse consequences once they've caught the virus. And there are a number of reasons for this. First, it's because when you look at the key jobs being done on the front line, those who work in shops, those who work in transport, those who are the cleaners, those who work in the NHS, those who work in care homes and so forth, and are so more likely to be exposed to the virus, they tend to be in disproportionately higher numbers, Black, Asian, minority ethnic people. Secondly, many of our communities of this racial background are in what's called 0 hours contract jobs. If they don't work, they don't get paid, they can't put food on the table or pay for the roof over their head. So they're not working from home as you and I can do so, having middle class jobs. Thirdly, because many of these communities are deprived or they live in overcrowded accommodation, the virus spreads quickly through these communities, but they also happen to have underlying health issues, blood pressure, heart disease, respiratory issues, asthma. And so when they get the virus, they're not as resilient. And so that's what we learned in the first wave. And the heartbreaking thing, Aisha, is in wave 2, we're still seeing a disproportionate number of Black, Asian, minority ethnic people losing their lives.
One of the other things that was interesting at the beginning is that a lot of people were just focusing on, oh, well, it may just be underlying health conditions. But actually what the research has shown, as you have just said, it's that they are more likely to catch this virus because of the job, particularly like bus drivers. And, you know, I know you've done a lot of work on that area.
I mean, look, one of the things that this awful virus has both exposed and exacerbated are the structural inequalities and frankly speaking, the institutional racism that still exists in our wonderful city in 2020, 2021. It's exacerbated it. And that's why you're seeing the numbers you're seeing in relation to those who are catching the virus and those who are losing their lives. And this has got to be a wake-up call, because the bad news here also is this pandemic isn't going to be the last one there is. And so what can't happen the next time there's a global pandemic is we see the same things happening again. That's why it's really, really important that there is a public inquiry, there is a reckoning, and we can take steps to ameliorate some of these structural inequalities that exist in our society.
I mean, the Prime Minister's saying now is not really the time for a public inquiry. Do you agree with that? If there were to be one, when would you want there to be one?
I can understand why our focus has got to be getting a grip with the pandemic. Our focus has got to be getting the vaccine rollout. My concern, though, about delaying this reckoning is we're not learning in real time things we could be learning to avoid things getting worse or replicating mistakes made in the past. I think we should, the Prime Minister should now be setting out what the public inquiry is going to be, who's going to conduct it, what it's going to entail, because it's really important we don't allow this to go on, because what we don't want is in 3, 4, 5 years' time having the recommendations made from a public inquiry. It's got to happen as soon as possible, and that's why it's important the Prime Minister confirms what the terms of reference is going to be, confirms who's going to be doing it sooner rather than later.
And when you say sooner rather than later, are you thinking a year, 2 years?
No, I think there's no reason why you can't set out now what it's going to entail. I don't want NHS workers, scientists, and others going to give evidence in the public inquiry now. They're going to be focused on getting a grip with the virus. What the Prime Minister can do now is set up the process and the structures, because we do know it takes some time to get things going. Things like who's going to conduct it, who's going to be the panel advising him or her, what will be the terms of reference, where will it take place. That sort of stuff can take place now.
Now, one of the councils that I mentioned that's been really, really hit by a very high COVID death rate and also has a high Black, Asian and minority ethnic community is Newham. But Newham are going to be looking to adopt quite an interesting policy whereby they will offer to pay for a hotel room for anybody who gets sick from COVID and gets a positive test, but they can't properly self-isolate at home because there's lots of other people living that way. I presume you think that's a good thing. Would you like to see that rolled out across London?
Well, I'm going to give Mayor Roxana Fiaz, the Mayor of Newham, huge credit for this pilot project. One of the things that the government's not understood is actually they are perversely incentivising people to leave their home, catch the virus, and indeed pass it on by not giving them adequate financial support to self-isolate. I've been lobbying the government since March. One of the issues I've been lobbying them on is to give people adequate financial support to self-isolate. It simply isn't possible if you're on a 0 hours contract, if you're working the gig economy, to receive any support. And if you are working and you receive statutory sick pay, it ain't enough to cover your overheads. And what's happening is people are basically risking their lives, playing Russian roulette with their lives and their families and their community because there isn't adequate support. And here's the really ironic thing. It costs more financially when somebody catches the virus and they're being treated, or when somebody catches the virus and passes it on in relation to medication at home, or when somebody can't then work because they've got COVID or long COVID. And so it's really important that the government realizes that actually it's cheaper to increase financial support for those self-isolating, but also it reduces the risk of the virus passing on. 1 out of 3 people who have the virus will show no symptoms at all. And that's why it's so important that Roxana Fiaz, the Mayor of Newham, is piloting this. So we've got the evidence to send to the government to say, listen, this pilot shows that a small expenditure of money in relative terms, hiring the hotel, was effective in reducing the spread of the virus.
Yeah, it's a really interesting idea. We'll definitely be following that up in the paper. Now let's move on to the vaccine programme, and the vaccine programme is rolling out really well, and it does look like things are going very well. But in terms of our communities, Sadiq, Black and Asian communities, there is a nervousness, there is a hesitancy. I have spoken to a lot, particularly older. I mean, for my community, people who are just a bit nervous about it. What's your message to those communities? And do you understand why there is a bit of hesitancy?
I absolutely understand why there is nervousness and hesitancy amongst Black, Asian, minority ethnic Londoners and those across the country. You've got to park, though, the anti-vaxxers, the COVID deniers, and the conspiracy theorists. Yes, they are spreading misinformation. In my view, we shouldn't engage with them. We should engage with them publicly because it gives them the oxygen of publicity and amplifies their messages. So you've got to park that. But the reality is, many members of our community, Black, Asian, minority ethnic, are understandably suspicious of authority. Their experience has been one where, in the past and very recently, institutions have let them down. They know about many drug companies testing in an immoral way, in a wrong way, some of their drugs on people of our ethnic origin. And so they're suspicious. And so one of the things that you've got to do is explain to them in a non-patronizing way what regulatory systems are in place to make sure the vaccine is safe. The fact that vaccines over the course of the last few decades have saved millions and millions of lives. But also the fact is, from Her Majesty the Queen to David Attenborough to my mum, they've all had the vaccine. Got it yesterday. And so the vaccine is safe. And so you actually give people confidence that it's safe. And so we've got to make sure we spend time explaining to people why it's safe, because here's the heartbreaking thing. We could have a double whammy. On the one hand, it's Black, Asian, minority ethnic communities who are suffering the most disproportionately in relation to catching the virus and the consequences. And on the other hand, they're less likely to receive the vaccine. And the latest data we have shows that Black people are almost half less likely to be taking the vaccine as white people in proportionate terms, and Asians about 3/4. And one of the things that we've got to do, yourself and me and others who, in a non-arrogant way, are opinion formers, are respected by members of our community, to explain why these vaccines are a game changer and a lifesaver. And whenever they're eligible to receive the vaccine, they should take it.
I sometimes think that some of the government messaging, it's very much going out through the mainstream media. A lot of, our elders in our community, they don't watch, the 6 o'clock news every night. They watch ZTV, they watch other channels. Do you think more needs to be done? Does the government need to think more kind of laterally and more creatively about how to get the messages out to different communities? Because not all Black and Asian people are this BAME lump of people.
I want to give Matt Hancock and Nadeem Zahawi lots of credit, because they've been working with me and working with City Hall to make sure government's messaging is now what's called culturally competent. You're spot on. We've got to make sure the message is one that is one that people can relate to, but also the mediums that we get the message across is one that is relevant to our diverse communities, whether it's using WhatsApp, using the satellite TV channels, using the sort of radio that's listened by many of our diverse communities, but also the sort of opinion formers who've got influence. The reality is, and it's not criticism, Boris Johnson is respected in various communities, and if he's the message carrier, that hasn't got the same resonance as, for example, David Attenborough or Lenny Henry or Adil Ray and so forth. And so, and to give Matt and Nadeem credit, they've had the humility, I think, to accept that. Yeah. And this is a really good example where we're on the same side. Look, whether you're a Tory or whether you're a Labour, it doesn't matter. We're on the same side here fighting this virus. And so we've got to be using all the tools in our toolkit to get the message across, because my mum very rarely watches BBC News at 6 or News at 10, even when her boy's on it. She'll rely upon her GOTV, ARY, the stuff, the Bollywood channels, Sunrise radios. And so we've got to work with those outlets and not be a snob when it comes to using them.
Yeah, definitely. And I think you make that point about cooperation and cross-party cooperation, and you're so right. I think the most counterproductive thing, particularly on an issue like this, is to be squabbling. And I don't know if you saw this video, but I thought it was brilliant. It was lots of Black MPs from across the Labour Party and the Conservative Party. You would never see Kwasi Kwarteng and Diane Abbott sort of coming together, but there they were saying, look, we've got our political differences, but on this, we agree, get the vaccine. Would you like to see more of that kind of working?
Oh, spot on. Why don't we work together on mental health? Why don't we work together on social care? Why don't we work together to address the digital inequality we've seen during this pandemic? The Standard's got this great campaign in relation to young people's mental ill health. We should be working together on those issues. We're going to work together on recovery. I mean, I've just finished reading John Bew's biography of Clem Attlee. It's called Citizen Clem. And what was remarkable, Ayesha, was during the Second World War, Churchill asked Attlee to be in his cabinet. Now, sure, you had some tribal Labour people saying, what are you doing? Ernie Bevin, Clem Attlee were called traitors, and those cries we know well of betrayal. For working with Churchill in the war effort. But They also, during the war, were planning for the recovery. And one of the things that I'm lobbying the government to do is, for goodness sake, work with me and work with us to plan for our recovery. Because if we're not careful, we could have this awful pandemic leading to the deepest recession we've seen in a generation. What we can't afford to have is go from a health crisis to an economic crisis. And so you're spot on. And you know, what some of your viewers and the readers of the Standard may not realise is, actually, you know, whether you're a Tory politician or a Labour one, the reason why you stand up to be counted is because you want to serve the public. You believe in public service. We may disagree about some of the means, but that we can discuss that. But we should try and at least agree on the ends. And so I'm looking forward to more of that cross-party work. And it was lovely. You know, who would have thought? And we both love her and admire her, that Diane Abbott would be, in inverted commas, sharing a platform, a virtual platform with members of the Conservative cabinet, and it's great. It's great to see.
Do you think the Prime Minister should think more about that? You know, a lot of people look at Prime Minister's questions, they see Keir Starmer and the Prime Minister squabbling, and I know the Labour Party is trying to be constructive, but they are also criticising. Would this be the time to maybe do something a bit different? We have got this milestone, you know, a lot of people have lost loved ones. Would this be the time for maybe sort of top politicians in the country to come together?
It would be, but to do that takes a huge amount of confidence in your ability, takes vision, it takes a sense of skill set that Boris Johnson hasn't got. Boris Johnson could have surrounded himself with highly qualified, experienced Conservatives to sit in his cabinet. He didn't do that. He chose yes men. You look at the quality of Conservative MPs in Parliament who aren't in the cabinet. So if Johnson lacks the confidence to have competent, experienced Tories in his cabinet, you can see why he's petrified at the idea of having Labour politicians working with him. What he should have done was to have regular meetings with Cobra where he invites Mayor Andy Burnham, myself, the mayors of Liverpool and Birmingham and elsewhere, working together in the national interest. What he should have done was ask Keir Starmer to be working with him in the national interest. And I think it's a sign of weakness, not strength, to be tribal. And we saw what happened last year with Dominic Cummings. And I think, unfortunately, Ayesha, we've not got that sort of leader to bring people together. And although there may be individual members of cabinet who are confident and collegiate, Matt Hancock, good example. He's been really good working with us in relation to, lockdown, in relation to what help we receive as a city. Nadine's been great in relation to run out of vaccine. And that's the sort of stuff you want to see more and more taking place. And so, yes, really good to see black MPs from the Tory party and the Labour party. Yes, different sides of the chamber working together, dealing with this pandemic and the vaccine. But I just don't think Johnson's got the strength of character to do that.
Let's just finish off by talking about mental health. You have spoken out, I think, very briefly for such a senior politician. And I know we say that there isn't stigma around it, but I think it was quite a big moment when you said you yourself were struggling with your own mental health. And I think it really struck a chord, because this lockdown really is taking it out of us. I've noticed that when, you ring people for a chat and you say, how are you doing? You don't now get the sort of fake, yeah, everything's great, everything's amazing. Actually, people take a beat and go, you know what, it's kind of tough. How are you finding this one? How are you feeling in yourself?
Well, firstly, I'd say it wasn't a political calculation to talk about how I'm feeling. And to be honest, I've always tried to be authentic and honest, but I've got to make the confession, which is, there are some people who work with me who were a bit nervous because they couldn't think of any example of a politician who's still practicing talking about this issue, particularly a bloke. I was told it's unusual and it's exceptional, and are you sure we're going to do this? Because normally in our leaders we look for strength. But I think it's not a weakness to be honest about how you're feeling. I think, I was feeling at low ebb. I have felt at low ebb. I don't say that I need to be medicalised, but I don't want to suffer in silence. And I think how I'm feeling mirrors how our city's been feeling in relation to people who normally have systems in place. Could be exercise, it could be going out, it could be seeing your friends, it could be religion, congregational prayer. and so forth, that provides us with the resilience to function effectively. And all those things were taken away, and I was feeling pretty down. And so, I want to be honest about that, because firstly, for blokes of my generation, it's very, very hard to talk about how you feel.
And also from your background.
Absolutely. So my religion, my ethnicity, but also, let's be frank, Ayesha, most male politicians are very alpha male. And so whole sort of things going on. But you know what? People who work with me said, you know what, Sadiq, you've always been authentic, you've always been honest, go for it. And so I've been honest, talked about it. Some people have criticized me. People have tried to say, are you fit to be mayor and stuff? But, I think you've got to talk about it, because my worry is there is another pandemic around the corner, which is a mental ill health pandemic. I've seen evidence of NHS workers in intensive care units suffering from post-traumatic stress disorder, the anxiety, stress, trauma they're suffering, children in our city suffering mental ill health, not necessarily in need of CAMs or GP referrals or inpatients, but in need of diagnosis and proper assistance and advice. But also, Ayesha, in our profession, you were involved in politics for a long time. We've got to stop thinking it's a sign of virility, working 24 hours a day, 7 days a week, being an alpha male, beating your chest and stuff. We've got to be honest about how we're feeling, because if you and I can be honest about how we're feeling, it may encourage somebody else who is a bit nervous about talking about it coming forward.
I think that's why I was so struck by it, because you and I worked together alongside each other as colleagues in the Labour Party. I've worked for many different party leaders. I mean, this sort of confession would be a huge red flag from a comms point of view. And I can understand why so many of your advisors might have been like, whoa, Sadiq, you're absolutely sure about it? Because even though we do live in a world which is definitely becoming more compassionate about people being honest about their feelings, we still live in a world which is very, very harsh on our political leaders. And so I thought it was a really, really important moment.
There are paramedics, medics, and those who work in hospitals who are seeing stuff that you see in a theatre of war. And it's really important for us to recognise that and plan for how we're going to help them. But we've got to plan now how to help teachers, how to help those who've been self-isolated. Our children are being taught to avoid bodily contact, avoid giving hugs at all costs. They've been encouraged to cross over to keep themselves physically safe. So how are we going to deal with that going forward? So this is a good example. When you talked about cross-party working, this is a really good example where you can be working together. The Standard can hold a ring in London in relation to what happens with young people, and you can bring people together in relation to a route map to how we get people's mental ill health back to being mental health. And one of the things that we need to talk about, Ayesha, you and I know when we talk about physical fitness, going for a jog, all the rest of it, the things you do to keep eating the right things. We never talk about mental fitness. So, what I want to see coming out of this is us talking about mental fitness. What do we do to make ourselves resilient to avoid mental ill health?
How do you look after your mental health? Is there anything you could share with some of our viewers and some of our readers? How does the Mayor of London look after himself?
Yeah, good question. So one of the things is don't suffer in silence, talk about it. I'm really lucky. I live with my wife and two daughters, and we've got a decent sized home. And we're good at talking. Not always the case. I've got 6 brothers and a sister. You didn't normally talk about our feelings when we were growing up. We talk about things, not our feelings. Talking is important. Also, what's important is doing stuff. And so it's difficult now during lockdown, but going for a run, doing exercise, we're lucky. We got Luna, our dog, 3 years ago. Little did we know that people would be begging us to borrow her to take her for a walk and stuff, because it's it gets you off your bum and leaving your house having to walk Luna. So you get to breathe fresh air and see nature. This is great. Zoom calling a mate, really important. Don't forget your friends, particularly those your mates who live by themselves. Also, there's some great TV on. I love some of the stuff. I Made History was great last year. Watching stuff on TV is great. I'm catching up.
What are you watching at the moment?
I'm catching up on lots of live music. So I've been watching concerts. We've got a foldaway running machine, so I've watched the Killers live, U2 live. I watched Bruce Springsteen. Bruce Springsteen concerts are really long, by the way.
Sadiq, you know what I love about this? You are such a centrist dad. I love it.
But I've been getting into new music as well. So Dua Lipa's new album is great. Physical, great tune. Michael Kiwanuka's Mercury Award-winning album is great. And so listening to music is really important to me. You can't go to the live gigs, but you can relive it, with YouTube and stuff. I rewatched recently, Ayesha, a few weeks ago, the BBC had some of the great Glastonbury concerts. I watched Bowie at Glastonbury.
Oh, wow.
I couldn't quite be there, but it was just so, so there's so much going on. And so one of the things we've got to think about as a city, and I'm really thinking about this hard, is people's leisure activities, shopping activities, and food activities have changed because of COVID. Deliveroo, Uber Eats, Netflix, Amazon, and so forth. The challenge for culture, theatre, cinema, shops, workplaces, leisure, is how we make the experience better to encourage people to want to leave their homes. And so, we've got to give you a reason to leave your home. And so that's a challenge I think we should relish.
Yeah, absolutely. Well, I live by myself, so I feel like you've done me a service having a chat with me today. Thank you so much, Sadiq Khan, for joining the Evening Standard for our lockdown sessions. It's been great to chat to you.
It's a pleasure. Stay safe, Ayesha.